Hello, my name's Annie Fox. I'm the head of brand and community here at Violet, and I'd love to welcome you today to our panel on caring in the time of COVID-19. And in particular, we're taking a focus today on the challenges of communication. We've assembled a small panel of people whose work intersects with the last stage of life, and also a carer, Janet, who has cared for someone in the last stage during COVID-19. Today, we'll be focusing on communication. It's an area that almost every carer that we've worked with and all the carers in our community who have reached out to us have had questions or concerns about. And certainly when we put the call out to our community that we'd be doing this panel today, most of the questions that came back actually came back around communication. We know there's challenges inherent with being a carer around communication, in particular being the sort of center point of information between your loved one's medical team and the wider family. And that at the moment, this is really made more complicated by the fact that oftentimes the wider family cannot now visit their loved one and see for themselves the condition they're in. We also know that obviously physical distance is making communication incredibly difficult at this time as well. So I'd love you to join me in welcoming our guests. We have Dr. Renee Lim, who is a locum doctor in palliative care and geriatrics. We also have Rose Dillon, who is the Experience and Engagement Manager here at Violet and also a Violet Guide. And we also have Janet Foster, who is a carer who cared for her ex-husband Ian for 9 years, the final months of which were during COVID-19. And she also has been supported by a Violet Guide. So thank you all so much again for coming today, and thank you for tuning in. So the first question, and this is often the case with carers, but they find themselves sort of playing the role of, I suppose, information keeper, sort of between medical teams and the rest of the family. But COVID has just sort of added to that stress because the wider family oftentimes can't visit and see their loved one for themselves to understand and sort of ascertain the situation their loved one is in. So Janet, this question is for you. How did you manage when you first found yourself in this role, holding so much of the information and having to sort of be the central control that was passing information on to wider friends and family?
Well, it was sort of like I'd talk to Ian about certain things, like everything that was going on, explaining the COVID. And then we sort of worked, we have a close family. So what we did is my son actually made the effort to come back home and live because he wanted to spend the final days with his dad. So that gave us both a lot of strength in this time, and we were very lucky. Distant families, we used media to do video calls, which was fantastic. And they sort of got to feel like part of it. So I guess it made me look out of the box that I was in on other ways that I could go about it. And a very important one is like with the communication with doctors, nurses, like just ask questions, like never feel as if anything is ridiculous, because this is your journey and they are there to give you that support. So don't feel foolish for any question that you may want to ask. And that way, that'll give you resilience, and you'll be able to help your loved one who's ill and other family members through this time. That's and, great. And go to a Violet Guide, and just so you can put everything in perspective so that you're not alone in carrying the weight of it. And that was a good experience for me, because it did take an overwhelming feeling off me where I didn't feel alone. So that was my experience.
Thank you, Janet. Renee, How about some practical advice for people trying to hold all of this information, which is oftentimes really complex, and then pass it on in a way that's most helpful to the wider family while also being the least stressful for the carer?
Look, that's such a complex question. And, you know, I think I see it all the time in the work that I do. I work in very great units where I think the support is huge, but no matter how good your support is, it's always going to be hard to take on the information, hold the information, process and understand it, and then work out how to communicate it with all these different people that you're trying to interact with. And most importantly, while respecting and holding the care of the person that you love who is going through this last stage of life. There are some really practical things. So I think the first one I would say is, I think absolutely support Janet. There is no such thing as a stupid question. Every question has a meaning and is worthwhile, even if it's just for the effort of asking it. Sometimes you just need to put the question out there to be able to start to make sense of things. But I think the ways that that can help you is write down. Whenever you think of a question, write it down, irrespective of whether you know you'll remember it. Just put it on a piece of paper. That allows you then to potentially collate questions from other family members or other people that come to you. You don't have to ask them all, but at least you know you've got them. Because often what happens when we're asking questions is we get very loaded with the anxiety of, have we asked the right question? Are we getting the right answer? And we get scared we might have missed something, or we might sort of like forget about other things that are on the table. So that's a really useful way to keep it all in mind. You can then extend that. And I know a lot of families nowadays who do things like have a WhatsApp group or even have, you know, a particular like way of using technology, as Janet said, to collect this information in one place so that everybody feels like they can add to this list of questions. Similarly with writing down responses, I think I really do encourage patients either for myself to write something for them or for them to just take notes as I'm talking, because that actually really, really helps. You can dial somebody into a conversation when the doctor's in the room and say, is it all right if I dial my brother, sister, you know, daughter, family member in? And part of that is actually also taking off the load of you feeling like you have to remember everything on your own. Somebody else in the room with you, they can share that load with you. And later on, you know, you might tag team, oh, I remember the answer to this and I remember the answer to that. So I think that's a really useful tool too. And I don't think many doctors would feel uncomfortable with talking into a speakerphone on a, you know, great thing about modern technology. The other thing that I suppose I do keep in mind is when you're thinking about how to share the information, you don't always have to, I suppose, solve it all yourself. You can actually, you know, pass the information on to one other person and then get them to try to share the information as well. So you can spread that load a little bit. It can be useful to create a time and tell your family or your, you know, your friends, look, once a week, let's organize a catch up where I can update you so that people also, they kind of know it's coming, so they don't have to check in and make sure anything's been missed. And the final one that I do sometimes find helpful, most doctors, will ward round in the morning. So that's when we're coming around with our team, checking in on the patients. We won't always know exactly what's happening at that point in time with the patient. By the afternoon, usually we're much more settled in what we understand about what's happening for the day. So sometimes you can actually maybe try to time things so that you may not be around on the ward round or otherwise you may be on the ward round to ask the important questions. But if you just want to kind of catch up and go, so where are we at right now? Sometimes that can actually be better in the afternoon. Come in and let the nurses know. The final thing I would say 100%, the doctors aren't the only ones with the information. I'm sure you all already know that. Talking to the nurses, the allied health, physios, OTs, social workers, all the other people involved, they will often know as much as, you know, us as the doctors will know, and they may have a better perspective to help you to understand things that you need to understand.
Thank you, Renee. That was fantastic. Rose, over to you. How can carers prepare themselves and also care for themselves ahead of these really complex conversations, given how oftentimes the weight of this responsibility can be quite enormous?
Thanks, Annie. Just following on from what Renee has said, I think it's really important for people to prepare ahead of time the questions that they may have. And in regard to this, I've just recently came across a document that was that is on the Palliative Care Australia website, and it's called Asking Questions Can Help. that's a really useful document that people might want to get hold of and have a look at. And it just groups questions by subject. And it's kind of a record that you can carry with you, or you can circulate amongst your family group. So that's a really useful document to have a look at. So in terms of preparing as a carer, well, firstly, I can't imagine how difficult it is at the moment with all the extra overlay of COVID that's brought so many barriers to people visiting and making it difficult for people. So on the one hand, for the carer having the responsibility of being possibly the only person that is able to see the person who's in the last stages of life, and then also having the responsibility for communicating that information. So I guess it's really important to be clear about the questions and to communicate that really well to family groups. And there are lots of different technological platforms that can be used for that. WhatsApp groups are great, and lots of other things, FaceTiming and various other things that can be used. I think at this stage, it's really important for carers to care for themselves. And carers as a group often leave that right till their own needs, right till the very last. The spotlight tends to be on the person who's very unwell at this stage. But it's really important for carers to look after themselves, to be kind to themselves and take some time out to look after their own needs. Just some really simple little things, like at the end of the day thinking, what's one thing that I did really well today? Or perhaps something that you might have done a little better, or thinking about how you've coped in the past with really difficult situations and remembering some learnings for that. Also, I think carers, it's really nice. Another nice thing to think at the end of the day is, what's one thing I'm really proud of today, and that I can celebrate in my own way. But coming back to the issue of communication, I think, as Janet said, no question is a silly question. And it's really important to keep asking questions until you're really clear about what the situation is. You don't want to walk away from a situation carrying all that responsibility when you're really not exactly clear what's happening. So keep asking questions. People don't mind. They want you to understand. It's easier for them if you understand exactly what's happening and you can communicate that to others. So I think that's the key, clear communication.
Thank you, Rose. And I loved your advice on sort of just giving yourself a little acknowledgement and a little self-compassion. I think that's fantastic advice. And this one's for you again, Rose. I'd love your thoughts on how carers can close the distance a little that they're obviously feeling right now, whether it's physical distance due to being interstate or whether they have a family member in hospital or residential aged care. And there's also that added complexity for those whose loved one is in and out of lucidity, or whose energy levels fluctuate hour to hour, and it's not always possible to catch them on a video call. You know, what are some ways that people can close that distance emotionally, if not practically?
Again, I think it's COVID has made this incredibly difficult for people. And often at this time, when a person is in the last stages of life, the timing of what's ahead is really difficult to predict at any time. But when there are restrictions about travel and restrictions about visiting, and the possibility that you might have to be in quarantine for a period of time before visiting the person whom you love, just makes things so much more complicated. Before COVID, perhaps there would be a few false starts where people would come to visit, and then we all know that people sometimes can look as though they're really unwell, but then they'll rally, and people then will go home and come back again. So it's really quite imprecise. So it's difficult for people to make those decisions about travelling to be close to a loved one. In terms of, again, I guess communication is the key, about communicating clearly what's actually happening. I think for the person who is in the last stages of life, if they are in, for instance, if they're in hospital or in a hospice, or even in their own home, if they have photographs and familiar things around them, that can really help, particularly if they're in a hospital and the staff are coming in and they can see photos. That's a way of starting conversations, and it can be quite helpful for the staff. It's extremely stressful for them too at this time, when they don't have the added benefit of having extra family members around to converse with. So that can be really hard. But I think also emotionally, as I mentioned before, I think it's really important to care for yourself, to take some time out for yourself, and also to be kind to other members of the family. Often this is a time when there can be family conflict, when people misinterpret information or may not completely understand what's happening. And I think the fact that you can't have easy access to the person whom you love just makes everyone's emotions much more heightened. So just take a breath before you jump in and be kind to other people, and they're in a stressful situation as well.
Thank you, Rose. Renee, carers, also due to the distance, feeling an increased sense of uncertainty because they oftentimes can't be beside the person they love who's in the last stage of life to make their own judgment about their condition. What are some questions they can ask the medical team if they're sort of trying to understand exactly their loved one's condition, but specifically if it's likely that they might actually die soon?
Yeah, I mean, that's a terribly hard one. And, and I suppose just to reiterate what Rose mentioned about stress, one of the things that I find hardest as a palliative care doctor is the need to distance, the need to kind of, have my mask on, the inability I have to connect to the patient. And I know that for families as well, that is incredibly kind of traumatizing to be stuck in that situation at various times. In terms of how you can approach the questions, I mean, the biggest question everyone always has is obviously how much time do we have left? And that is almost an impossible one to answer. One of the things I would say is it's really helpful, if you feel you haven't received this already, to have a conversation with your doctor or the nurses about what you might be expecting in terms of how this will look in this last period of time. So what will, the patient be going through? What will your loved one be experiencing? What might you be looking out for that helps you to also feel that you don't have to keep asking somebody else to tell you how your loved one is doing? Because I think that's quite disempowering. So we can often express a number of different, I suppose, behaviors or things that we might look for that help us to know if things are changing. If, on the flip side of that, obviously, we don't want people sort of feeling like they have to sit there and overly hyper-vigilantly monitor the person that they love who is going through this period. That's kind of our job. So some of the ways you can approach that, which maybe are simpler than, is he okay today? Which is perhaps a very difficult question to answer. Some questions like, has he had to use any extra medication? Can be a useful way for us to explain that things may or may not be different. Something like, how did he sleep overnight? We know that often towards, the later stages of life, sleeping changes. And that can be a tool for us to know if somebody slept well or didn't sleep well, if there were, periods of time where they were more upset. Often, actually asking the nurses is going to be more useful than asking the doctors, to be honest, because they're the ones who are going to see them and keep track of what they're doing throughout the night and into the daytime as well. And I suppose the other things would be, what is your priority? What are you most worried about? So the things that I think I tend to find with patients and their carers and loved ones is, number one, is he suffering? So there can be a question there specifically, is he in any pain? Does he still feel sick? And those questions can be reassuring to have an answer to, if we can explain what it is we're doing and the fact that actually we don't think he is. And maybe giving you some ideas as to how you might be able to notice if you want to check and see if he's in pain. There's some things that we can look for, and we often will explain those to carers and loved ones. The second thing that's often important is being able to talk and be awake and have cognitive capacity, as we call it. So still being able to talk to people and interact like you used to. So, the question might be, how is he doing today? Has he had a chat to you? Has he been able to speak to you today? And that might give you the feedback that, again, that that you're looking for is to know, how is he mentally? How is he, is he waking up? And those kinds of more specific questions might allow us to answer something that we may not know we need to answer otherwise, and we might not have realized that was your main concern. So those sorts of things can be really helpful. As I mentioned, the suffering one, I think, is a common one, and that being awake or being asleep is often one that people want to know about as well.
Thank you, Renee. Janet, this is for you. There are, of course, still many carers who are caring for someone at home, but COVID has created some complications in communication there too. How did COVID make caring at home more complex for you, if at all, Janet, particularly around communication and coordinating medical teams, community service, friends and family, that sort of thing?
Well, for us here, it was really good because we had a good team. We had a really good doctor who worked in well with the palliative care team, and they were both very professional. So that was a really good point, good strong point for us, and informative with what we were going through. So that was what I worked from. I reduced home care at that time because I didn't want Ian to be put in a vulnerable situation with his respiratory system at that stage. So I did isolate and only have medical teams come out. And that was how I wanted to deal with it. And Ian was happy with that at the time because it maintained giving him his wish of passing here at home with loved ones. So I guess sometimes we just have to do a little bit more work, but be thoughtful of yourself while you're doing it. Like, share with another family member if you're lucky enough to be at home in the situation I was. So don't take it all on yourself. Communicate clearly what's going on so that you're both understanding, and therefore it's very supportive for everyone in that family unit to be able to move on in a very positive way, where the goal is to get into what he's happy with doing. And I think too, at that stage for me, it was also when I did approach a Violet Guide, and that sort of made me feel as if I had made the right decisions, because it was like I was able to reflect to the guy what I was going through, and it was just good to get feedback and know that through those situations and in the house and what we were going through with COVID, it made it all better. So it wasn't overwhelming. So yes.
Thank you so much, Janet. And thank you everybody for joining me for this Q&A today. Our community of carers often says to us that it's the blend of personal and professional wisdom that helps them the most. And so I really thank you all for sharing both your professional and personal wisdom with us today, and all the carers out there. So thank you. Before we go, this is a tough time for carers, we know, and it's made only tougher by COVID and the lockdown restrictions. So if you or someone you know would benefit from Violet's support, please reach out. You can get us on 1-800-VIOLET or through the website violet.org.au.